Thank you. And now I'd like to invite John Weston from Administration from Community Living to introduce today's programming. Thanks, Jonathan.
Emma, thank you, and good afternoon, everyone from a very chilly Washington, D.C. I am thrilled to be here today to talk about with all of you and learn from so many of our speakers the work that they are invested in and the country is invested in regarding bolstering financial and workplace security. This is a key goal of the National Strategy to Support Family Caregivers. I'm John Weston. I'm an Aging Services Program Specialist with the Administration for Community Living, and I'm also the grant officer for a whole series of caregiving grants and investments within our aging network that the Administration for Community Living has made, and that's called the National Caregiver Support Collaborative. This was a evolution, a growth out of the issuance of the National Strategy to Support Family Caregiving in 2022. We're currently working on the first update to the national strategy. This is a key initiative that we hope will bolster greater recognition, support, and inclusion of the family caregiver served by the National Family Caregiver Support Program, as well as the Native American Community Support Program. I should say Caregiver Support Program, forgive me. Comprising the Technical Assistance Center, which is a part and parcel of our work here at the Administration for Community Living within the National Caregiver Support Collaborative. We have 6 dynamic grantees that are focused on caregiving priorities that will support implementation and advancement of the 2022 National Strategy to Support Family Caregivers. Next slide, please. We have a target audience. I mentioned at the outset the Aging Network. That includes, within the Older Americans Act, area agencies on aging, shorthand for that is the AAA, the state units on aging, local service providers, Title VI providers, Native Hawaiian organizations, kinship organizations, and disability service networks. What these audiences seek to do through the services they provide is to address the needs of caregivers that represent certain populations that we focus on here at ACL, most notably older adults, people living with early onset dementia, people with disabilities, and older relative caregivers of children. Next slide, please. So this is the first national scale capacity building effort that we have done as an agency in over 2 decades as we seek to innovate and update both the National Family Caregiver Support Program and the Native American Caregiver Support Program. And we hope that through our work of the National Caregiver Support Collaborative, we're able to improve alignment between these 2 large programs, as well as alignment between not only those programs, but other ACL initiatives that strive to improve the lives of caregivers and care recipients. We currently have 6 grantees that are part of the National Caregiver Support Collaborative, and the Technical Assistance Center that we have formed to help not only carry out or have our grantees carry out their mission, but also educate and engage folks like you who are tuning in to the webinar today and who are very vested for a multitude of reasons in the work that we have within the caregiver sector. So we do hope that through our work with the grantees, that you'll be able to not only be educated by webinars such as this, but also explore different tools and resources to support the Aging Network, most notably on the ACL microsite, which is acl.gov/NCSC. Next slide, please. The 2022 National Strategy to Support Family Caregivers comprised 2 councils with 5 shared goals, but 1 major vision. I cannot overstate enough the importance of Goal 4, ensuring financial and workplace security that we'll be learning about today. But there are other major components of the strategy. For instance, increasing awareness and outreach, which can be found in Goal 1. Goal 2, advancing partnership and engagement. This is a goal that really is focused on care coordination. Goal 3, how do we bolster and increase services and supports for caregivers? I mentioned 4 about financial and workplace security, which has become all the more timely given affordability challenges, given labor shortages that have impacted direct care workforce, as well as different innovations that we are seeing, not just in the private sector, but also in the for-profit and not-for-profit sector around Goal 4. And finally, there is Goal 5, which is expanding data, research, and evidence-based priorities. And given the fact that our grantees are working as a collaborative, as a team, it is very important as a takeaway for you today to understand that Donna Benton, who is the lead for Goal 4 from the University of Southern California, is working hand in glove with our other grant leads who represent the other vital work being done in this strategy. Next slide, please. So if you visit the NCSC website, again, that's www.acl.gov/NCSC, you'll find a great many resources that have been developed by our partners with the Technical Assistance Center. And they include the Caregiver Promising Practice Spotlight Series, Caregiver Assessment Profile, and a checklist for caregiver assessments. Next slide, please. Excellent. Well, I want to thank you all very much, and let me turn it back to Emma Coppola.
Slides and materials will be available on our website, which you see linked there in the weeks following this event. So quick housekeeping, if you'd like to submit a question, please use the chat feature. Thank you. I see we have some folks who are testing out this feature as we speak. Excellent. Feel free to submit a question or comment at any time. We do have a dedicated question and answer session later today, and we'll get to as many questions as we can. To access closed captioning, similarly, you should see the closed captioning icon on the bottom of your screen. Please use that. And everyone should see our interpreters. Thank you for being here today, using American Sign Language on the screen. If you have any questions or concerns about accessing today's programming or interacting with our platform, please feel free to submit a chat. Next slide, please. Great. So here's what we have planned today. We've heard from John at ACL. Thanks so much. And our esteemed speakers, who I'll introduce shortly, will be grounding us in an overview of the caregiving landscape with a deliberate focus on financial and workplace realities. We'll talk a little bit about opportunities for collective action to advance this important topic. As John noted, this is Goal 4 of the national strategy. And then we'll really dive into a conversation with our panelists about how they're operationalizing strategies and actions, tools and resources to support caregiver financial and workplace reality. Next slide, please. We hope you leave today with practical strategies to strengthen family caregivers' financial security. So I urge you all to think about what's one thing you might hear today that you could take away and do something with. And also we'll be learning about, again, those practical, tactical strategies for partnering with employers and community organizations to address gaps in caregiver support in the workplace. Next slide, please. And without further ado, I'm excited to introduce our experts and speakers today. We have Duana Patton. Thank you, Duana and Donna, for being here. Duana is the Chief Executive Officer of the Ohio District 5 Area Agency on Aging. She also serves on the board as the president of the board of U.S. Aging and the Ohio Association of Area Agencies on Aging. and is the president and CEO of the Area Agency on Aging Foundation. And Donna, thank you for sharing your expertise. Donna's a research associate professor of gerontology and a director of the Family Caregiver Support Center at the University of Southern California, Leonard Davis School of Gerontology. Donna leads the National Caregiver Support Collaborative Goal 4 grant that Jonathan mentioned earlier, and we look forward to hearing from you both throughout today. Duana, I'm going to ask you to kick it off for us and ground us all in a few facts about the caregiving landscape.
Thank you, Emma. And it's just wonderful to be here today and talk about something that is so important as caregiver support and the work that we do. I am excited to share with you some national data. To start us off, in 2025, new data was released indicating a rise in family caregivers, many of whom are balancing their own care needs, their financial stability, and their professional lives alongside caring for a loved one. This is no small feat and creates significant barriers to caregivers having their own basic needs and well-being met, in addition to their potential for career development and financial security in the workplace. Next slide. The burden of balancing caregiving and work impacts not only caregivers and their families, but also employers and the work economy and the community. Examples include 60% of caregivers experiencing work disruption, including both absenteeism and having to leave a job because of competing caregiving duties. Employers are juggling the flexibility of work policies and the needs of their staff, such as reduction in hours, flexible schedules, or paid time off, and workplace culture inclusive of family caregivers to try to avoid losing talent who feel forced to give up their own careers. Aging network providers can help educate employers and partner with them to ensure workplace culture is supported by the use of engaging caregivers, and to ensure that we continue to help build awareness around caregiver support services that are available in and throughout our communities. Next slide. We know that employment is just one factor that may contribute to caregiver stress about financial security. Caregivers are spending exorbitant amounts of money out of pocket on caregiving expenses, impacting financial health for at least 50% of them. This means long-term financial strain and an immediate impact on their daily finances. For example, caregivers spend 26% of their total personal income on caregiving activities, and this is on average. This calls for action so that caregivers do not have to choose between paying for their own necessities and caregiving expenses. One thing aging network providers can consider is opportunities to expand respite care, offer respite care, adult day services, and peer support groups that give caregivers time for work and financial management. Providers can also consider efficiencies for caregivers in time and resources spent accessing services. For example, reducing the amount of time caregivers spend filling out repetitive forms and navigating sometimes complex systems. Next slide. And I'll cue it back to you.
Thanks so much, Duana. Donna, I invite you to join us on screen. We'd love to hear from you about what USC is doing in this space, and hopefully it'll generate some ideas for our participants about actions they could take to address caregiver financial and workplace security.
Thank you so much. Next slide, please. So we have a big opportunity right now to take within our roadmap a collective action for family caregivers, particularly around the constellation of supports that are needed for family caregivers. So that includes, we know that goal 4 is a discrete goal that's focusing on ensuring financial and workplace security for family caregivers. My ideal outcome for what cross-sector success would look like is, we really don't want those negative long-term effects on a caregiver's financial health, because a caregiver may enter this stage anywhere from the age of 20 to 40, which is somewhere the average is around 45. And when people jump in, they don't always think about their long-term financial health and well-being. So we want to, with this goal, really find ways that we can intervene so that we can keep financial health and access to workplace policies that are good for our family caregivers. Next slide. The other things that we want to be able to do is we want to make sure that our impacts that we make are based and grounded in evidence that really makes things accessible, but also that people will use. So we want to have support services that we know have high impact in the workplace and out of the workplace. We want to have really a culture of caregiving which means that you have to understand who caregivers are and identify them, but they have to feel safe in their environments, and we need to support that. We want to have delivery strategies that implement both public, private, and governmental sectors and allow each other to learn from our peers about programs that are being used across our nation. We want to commit to building this kind of cross-sector partnerships. That means that sometimes you might be working with a nonprofit, and you might be working with a small business, and you could also be identifying public figures that can also help out. So we know that it's important to also promote financial education and planning tools, not just what people will find by Googling, but being able to use programs that we know work when people understand finances and planning tools before there's a crisis. Next slide, please. So what are we doing at our center, and what was our goal when we applied for this? We really want to take goal 4, which is we need to align our national strategy, and we want to be a national hub to help the area agencies on aging's network organization understand how to address effectively financial and workplace security with both employers and for family caregivers. So what that means is that we are going to we have one thing is we're going to have a clearinghouse, and that means that we're going to have financial and workplace stability for family caregivers, because we're going to improve capacity by having more of the area agencies on aging and other agencies being able to work in this area around financial and workplace security and feel confident when they are providing programs. We want to have, and we are developing, a really strong learning collaborative. And that means that we're bringing together experts in all of the different aspects around finance and workplace in one place to help really guide the project, so that when we have a clearinghouse, it means that everyone will feel comfortable using it. And that includes family caregivers are essential part of our learning collaborative. We're identifying and curating resources for family caregivers and their care recipient. And so that means that the information that we're providing has to be used by various age groups at different incomes, and be comfortable using it for the way that we are curating and identifying information. But you know what? None of it is any good if people don't know where to look. And that's going to be where we are inviting everyone here to work with us on dissemination. And then we have to refine some of the products that we find through our identification that there are a lot of things out there, but are there barriers to why people may not be able to use them? Are there barriers to programs that we can't sustain them because of cost, or because of the way that you have to administer them. So we want to refine products so that we can address these barriers and ensure that there is a sustainability of resources. Next, please. So I already said, please, we want to engage with you and we want you to become part of our learning collaborative. And so how do you do that? Well, you can visit our webpage, and when you visit, subscribe to our Family Caregiver Economy Digest. That's just kind of an easy way to begin engagement. We have webinars, like, for example, the state of the art in caregiving in the workplace. And we're going to have podcasts that you'll be able to listen to. So you could listen to Working Caregivers around the invisible employees, which is on episode 13. We have, you can write and say, hey, I want to be a little more than just reading about everything. Maybe you have a program that you want to highlight where you say, I want to be on the podcast. I want to be able to be part of the newsletter and write something so that people know what we're doing in our state. I want to be part of the Learning Collaborative where you'll attend more meetings and come and engage with us. So please, there are many ways you can start engagement, but the minimum is we have to know how to reach you. So go to our webpage and subscribe to the newsletter, and that gets you started. Next. So at this point, I'm turning it back over because we're going to have our panel discussion. So thank you. I'm going to turn it back to Emma.
Thanks so much, Donna and Duana. And don't go too far because we'll be hearing from you again. At this time, I'd like to introduce my colleague from the Technical Assistance and Coordinating Center, Leah Moran, who will facilitate our panel discussion. We look forward to hearing more from you all. Leah, take it away.
Well, thank you, Emma, and hello, everyone. I'm Leah Moran, and I am just thrilled to be moderating today's panel. So here on the slide is a preview of some of the topics we will cover in discussion with our experts today. We have examples of facilitating change at a local level, strategies for partnership to increase impact, concrete tools and resources, and finally, ideas for immediate no-cost or low-cost action. So for our first topic, we will be looking at some examples of facilitating change at a local level. Duana, I'd like to start with you for this topic. For the audience's reference, could you please start by just sharing a bit more background on your role and your organization?
Certainly, thank you. So the Ohio District 5 Area Agency on Aging is located in a very rural area of the state. Our organization is very passionate about making sure that we see people before they're in crisis, and that includes caregivers. So when we're talking about this particular topic, the Area Agency on Aging is responsible for overseeing Older Americans Act funds and many other programs that happen across our state and even here locally. And so we try to really focus on caregivers in any type of program that we are executing on. So we're an organization that's very rooted in the community, very level set, and have a foundation built on the Older Americans Act and the work that we do to serve older Ohioans and their caregivers.
Excellent. Well, thanks so much for that added background. I think that really speaks to why we're excited to have you here on the panel today. And so could you tell us about what is happening at that local level at your AAA in Ohio, and what are some gaps or challenges that you are aiming to address through your initiative?
Sure. So when we think about caregivers, we've been serving them for many years under the Older Americans Act, being a resource to them. And it was our own experiences as an employer when we recognized that caregivers aren't just providing care in the home, but they're working people in our communities. And so at that point in time, we realized that we ourselves needed to look at our own policies and procedures and what were we doing as an organization to support caregivers. Fast forward to today, we've said what's best for us as an employer, because we know about caregiving and we know those challenges, is to make sure that our community members know. So we began to build our board acumen to make sure that we had diversification on our board representing businesses. But really, what we were identifying is caregivers, not only did they feel alone and isolated many times, but a lot of that had to do with just navigating their own personal needs and their own careers. In Ohio alone, the value of unpaid caregivers is estimated to be about $21 billion annually. That's a lot of money. And there's a lot of value to that. In addition, we also know that there are workforce challenges. And when we think about the value of informal caregiving and the value of the workforce, we want to marry those things and make sure that we're supporting both.
Thanks, Duana. And I've heard that communities in other regions as well are facing many of these kind of similar challenges. So I'm sure that some of those challenges and gaps are really ringing true for many on the phone today. So could you tell us just a little bit more about where you faced the most significant barriers and what are some strategies that have helped you overcome them or to make measurable progress?
I think our biggest barrier was really reaching out to employers. One, it's not a network that we normally work with. So we had to find ways where we can, and we continue to do this, is to make sure that we're connecting with employers and ensuring that they understand what resources are available to not just them, but to their workforce. And then again, providing them with the right information at the right time, not burdening them with a whole lot of information all at once, but really just building that relationship and that trust so that they see us as a leader in the community, as someone who understands caregiving. And really just meeting them where they were. But it was probably the most significant barrier that we had because businesses are thinking about bottom line, right? They're just trying to run their organizations and keep their people employed. So really just leveraging our influence and our knowledge to help them understand that, their employees, are facing caregiving issues and we can be a resource to them and to their staff. So it was a barrier, but it really was one that we were able to overcome. We're still working on it. We've got lots of employers, but it really had to be intentional.
Mm-hmm. Absolutely. Well, thanks for sharing those additional details, Duana. And I now want to expand beyond just the local level to talk about how partnerships have really informed the work that both you and Donna are undertaking. So for topic number 2, to Donna first, could you tell us about the role of partnership in executing your grant? And I'd be interested to hear how partnerships have shaped your work groups and the micro grants that you've awarded as well.
Oh, thank you. So let's first talk about, generally how we started our partnerships. It became very important when we started the center that we look for area agencies on aging. We look for business savvy people. We look for family caregivers to help review everything that we want to put together in a clearinghouse and how we want to approach the topic of financial and workplace security. We always start, you're academic and you want to say, oh, we're going to do a systemic literature review, but you can do all of this reviewing, but if it doesn't make sense on the ground to the people who will be using that information, it's not going to be implemented. So part of our first role was getting people who could represent all of the different aspects of financial security. So we have people right now who are on there who have clearinghouses of their own. We have people in private practice. We have folks from other parts of the national collaborative who are looking at assessment and making sure, are we asking financial questions in an assessment, and how are we doing that? We're looking at the ability to make sure that we have people on board like family caregivers who understand serious illness and how does that impact their finances. We have to understand from the caregivers from workers. So we have employers, large employers and small employers represented, and we even an HR. So there are a whole bunch of people who are on our collaborative who meet regularly and review before we put out a product or come up with an idea. And they're guiding what are going to be the critical pieces that we're going to need in our overall collaborative, and what do we need to learn from each other. And so it's that cross learning that's really great. And of course, we have area agencies on aging within the collaborative who have tried to work with businesses. And so businesses can say, well, this is how you approach us. And the area agency and aging can say, oh, okay, I didn't think of that. So I did I answer both of your questions?
Yeah, I think so. And it sounds like you really just
Oh, the
have
micro grants. So
yeah, if you want to add, I
I
know we'll be
wanted to
getting to that
talk
later
about the
too.
micro grants. Yeah, so that's exciting. So one of the things that did come out of this collaborative is that there are a lot of tools that that people are using to reach employers, but we wanted to try to put together, thank you, a tool that we're building our toolkit that takes the best of, like the best of all the toolkits and kinds of puts it together so that you can have a template for your area agency on aging or local agency to that you can use when you're reaching out to employers of all size, because the largest employers are usually like 5 people and less. And then there's the larger and the medium-sized employers. So the toolkit, in order to make sure that it works for an area agency on aging and uses a good model, we put out for pilot testing, and that came out from our group. So we have three people who are going to be testing it, agencies who are going to be testing it. One is Seattle King County. And they're really, I think this is really interesting, is because they're going to be looking at a younger employee group. And so they're going to be looking at the city of Seattle in a health literacy, and they're going to be focusing on health literacy within the city. We have Upper Coastal Plains Council of Governments, and they're going to partner with hospital systems, which we know rarely think about the finances that might be impacting the caregiver or the care receiver. And so we're working with them. And then Ohio, we've already heard from, but I don't know, this is District 5, Area Agency on Aging. And they're going to work with a very specifically with a local manufacturer who's a large regional employer. And we're going to test the toolkit there too. So we're testing a toolkit. We're testing ways to hold sessions and build trust, but we are using it within a model that we know will be that most agencies may not think of how to engage. And so we're using an engagement model that comes out of our systemic literature review gap findings.
Terrific. Thank you so much, Donna. Sounds like some really exciting micro grants. I'll be asking you a little bit more about that toolkit in just a moment. But just wanted to circle back to partnership as well, because it sounds like you have a really robust group of partners there that are informing your work. So, Duana, I know that you've also engaged local chambers and even welcomed chamber leadership onto your board. So, how have those relationships influenced either your outreach, your credibility, or your access to employers? And if you have any advice that you might offer to peers who are looking to build similar partnerships at that local level?
Thank you. Great question. Yes, we have added a member of, actually, it's our chamber president here locally to our board for a lot of reasons, but certainly this initiative and, our mission to serve caregivers was influential in that board appointment process. We do see our chambers as very trusted partners in our communities, and I also believe that sometimes they're the most underutilized when we think about the work that we do. So we've been working on this relationship for a very long time. Again, now have someone on our board. But what that has done is it really has opened the door for opportunities to talk to different businesses, different industries. As Donna had mentioned, we're going to be working with a manufacturing organization that is regionalized throughout our communities and look forward to building that partnership. And it has so many opportunities, just, not just for caregivers, but also for education of their older workers. So, I mean, this initiative in itself has opened the doors for many relationships. So, working with the chambers, they're the trusted source for businesses, and it was an easy lift to build that relationship, and then it has opened many, many doors for us. I think the other thing that is really important as an organization, we looked at different projects that we were working on. So we're working on an age-friendly initiative in a community and not just focusing on that initiative solely, but also thinking about this caregiver work and thinking about the national strategies, for caregiving and thinking, how do we layer one project on top of the other? So how does it bring value to other, opportunities and initiatives that we're working on? And so a lot of this is very intentional. Advice for my peers, get to know your chamber, the leaders in your chamber, invite them to your organization, let them understand who you are because they become a voice. They become a voice to their members and a referral to you. And I think that, for us, we have treated our chambers in and across our region as partners, not just as our Chamber of Commerce, but really as partners. And we make sure that they know that, and we make sure that they are invited into and understand our mission. And then again, looking for those meaningful ways to connect and collaborate. So maybe leveraging programs that already exist or other strategies and looking holistically across the organization and making sure that perhaps one leverages another.
Terrific. Really excellent tips. Thank you so much, Duana. And now I want to take us back to topic 3 here. I know that our audience has shared on past webinars that they're always really eager to stay informed about what tools and resources are out there. So let's turn back to that now. And Donna, I'm wondering if you could expand on the part of your toolkit, which is designed to empower AAAs to embrace working with employers and to finance that work as well.
Thank you. One of the things that we really are emphasizing in our toolkit is that you have to begin with that relationship, which is what was already mentioned. And so we have a model for engagement. And I think that that is sometimes we think that, oh, all we have to do is talk to somebody or, make a friend, and then that's all you have to do. But there are very systematic steps that are important for engagement. So the first thing is you start with a small committee, and that's making sure that you begin a partnership and you begin those discussions. Then you come up with how are you going to approach this? What's going to be your mission? The next step might be piloting very small projects or working with there to do a survey and making sure that it has the right questions. And so then we kind of go through this way of engagement, and each time you reevaluate your steps. You ask yourself and you assess within this partnership who's missing, who should we add? And you don't want to just kind of go out there and make a big splash. It's as it was already said by Duana, it's very intentional. It can be a slower process because you're going to go back and do these evaluations as you go along. But that's how you begin to build trust with organizations. And you have to choose what you're going to tackle. If you're going to say, I want to work with small or large, you can't do both at the same time because they're very different approaches. Or if you want to say, I want to do something that's going to do more policy and changes of policies around sick days, then that's a different kind of collaboration. So our toolkit allows you to decide who you're going to work with, and then there's so many great resources already out there. We're giving you kind of resources that you can already have your Instagrams and your topics and things like that, and how to do the assessments and surveys. Those are in the toolkit, so you don't have to recreate the wheel. But what we can't create for you is that culture. And that's the beginning step that's so critical and for making a supportive workplace and to use these tools and resources.
Wonderful. Well, it sounds like you all have taken a really thoughtful approach to building trust and to building out that toolkit as well, evaluating if you have all the right partners in place. So that's really exciting. And I want to stick on the toolkit now, but turn it to Duana. So, from a local perspective, and to hear more about how this could be put into action, what value do you think that USC's toolkit could bring to your network?
Well, first and foremost, the value of time. Donna and her team have just done some incredible work with this toolkit. But AAAs across the country are committed to supporting caregivers in any way possible. And I think that it's important for us to meet them where they are, which many of them are at work. But the toolkit will really allow us to be consistent in our messaging. And as Donna had indicated, not all employers are the same. And, from a culture standpoint, or maybe even a value proposition, they may focus on resources, or they might want to dig into their policies, whatever it might be. This toolkit allows us to have a consistent message, but also be nimble in how we're working with the providers across our region. We frequently receive referrals from employers who are looking for help for their employees. And I think that this toolkit, or I know that this toolkit is really going to help businesses guide their own team members, and not just their team members, but maybe their HR teams or their leaders who are working with their staff members. I think we haven't even began to realize the value that this toolkit's going to be. We haven't really stepped right into it, but I envision that it's going to have impact beyond what we can even imagine. I do know that it's going to allow employers to have information and tools and guidance that they've not had before. And maybe it's just picking up the phone and calling us, or using the toolkit that they have available to them. We're going to be working with a local provider or employer here, Gorman Rupp, and they're going to test materials, help us provide the feedback that's needed. They're going to help us develop the sustainability. And I think with anything that we try, we want to make sure that whatever we test and try builds some sustainability, and that can be replicated in diverse settings across the region and across the state. I think it's also going to enable us to take a more proactive approach, which is something that we're always looking for. How can we proactively serve caregivers? And oftentimes we get a call for the caregiver that's on the verge of losing their job, or the caregiver that's really stressed, or is finding themselves with no information and no hope in how they're going to just manage work and caregiving. And so I really think that this toolkit and the resources that will be available are going to help our caregivers when they need it most, but most certainly proactively by connecting with their employers first.
Thanks, Duana. I really appreciate you sharing those ideas about how the toolkit could be implemented. And before we move to our last topic, just wanted to see, are there any other tools or resources that you've developed in Ohio that you would like to share with us?
Well, thank you for asking that question. Yes, there are certainly other things that we are doing, and a lot of that is around the intentionality of making sure caregivers know who we are. And also, when we bring someone in through our front door, when they call us and need help, we always make sure that we find out, is there a caregiver involved? If it's not the caregiver calling us, if it's another referral source or the individual themselves, part of our process of assessing an individual is identifying that caregiver. And so it's a little bit again of that proactive approach, whereas we leverage the information and the tools that we have to find the caregivers when they're coming to our front door.
Great. Thank you so much. All right, now turning to our last topic here and staying on this topic of ways that folks can really be taking action. For our final question, what is something actionable that members of the Aging Network could do to better support working caregivers in their states and their local communities? So, Duana, I will start with you for this one.
I think the first thing is, and I said this when I started my presentation, was I think we first have to walk the talk. We have to look into our own organizations. It's usually the easiest place to start, and making sure that we ourselves as organization, as businesses, are walking the talk and making sure that our own practices and our own policies support caregivers. I think we also have to ensure that our services are accessible to the working caregivers and not just those that are providing care in the home, but recognizing that we have to be, again, meet caregivers where they are. And that's really, maybe at their place of work or through their employers. Again, building those strong employer partnerships and integrating and engaging employers into the work that we do. Focusing on workforce strategies, focusing on how we can add value to employers. I mean, it's economics. We've got to just, be there to support employers who are employing individuals and making sure that they have a career path and financial stability. I think we have to collect and share data willingly. Gather as much as we can as it relates to caregivers and the impact that, pilot projects or resources, have on the caregiver, on the working caregiver and, the unpaid caregiver. So again, collecting that data and being, free to share that data with others who can help make a difference. And then be consistent. I think we have to be consistent, which is what we believe this partnership with USC and ACL and all that really made this happen is be consistent and make sure that this toolkit helps us achieve exactly what it is we want to achieve. And that is to help working caregivers maintain financial stability and be the best caregiver they can be.
Wonderful. Thank you so much, Duana. And those are really great suggestions. I feel like they reflect the very unique needs of this population of working caregivers as well. And then, Donna, to round us out, what recommendations do you have for taking action on ways to support working caregivers?
This is, I want to follow up on what Duana was saying, which is look inward, start with your own organization, and how does your organization work with caregivers? Because I'll tell you, from our doing our large literature review, we found that, which is kind of surprising, that actually the reason that there's a utilization gap, meaning while people are aware that they may have paid family leave or sick days, or the utilization is just phenomenally low. Why aren't caregivers who have access to things that might help reduce the strain, reduce the financial impacts of their caregiving, why aren't they using the care navigation services? Well, we found out the answer for that is there's a difference between having a policy that can be accessible, but it's not accessible if the culture does not support the policy. And what that means is there's a stigma and fear of negative repercussions from supervisors that may prevent employees from even disclosing that they're caregivers. So if somebody is afraid, so that's the biggest gap that we found. Looking through all of these resources, we came down to 15 really good studies. So one action that you can begin to take is look within your culture. Is there a culture where when somebody takes time off, you're kind of discouraged or someone asks for time off, are the leaders willing to say that they're family caregivers so that they can begin to understand the flexibilities that are needed? So remember, culture, not just policy, really determines whether support is even accessible for our caregivers. The other thing is, it's not just one thing that can be an answer for caregivers. So we may say, oh, well, everybody needs care navigation. We found that there were kind of three very good models that came out from our studies. We saw one was called the STAR intervention that really focused on, again, for that culture gap, training managers to increase an employee's control over their time and processes. And that, again, helps build that trust. We had another model that was around caregiver workstations, where you have these kind of multi-component interventions where a caregiver can go online and find webinars and support groups and online information that are within a workstation that's accessible to all levels of workers, and people are given time to use that navigating tool. Because if you're kind of like, oh, well, here's the tool, but don't do it on work time, that's not going to be very supportive. Another one that we found is like maybe you want to help employees if they're going off, is maybe within your employee organization, you're going to do something that helps build skills so that people can re-enter the workforce. And that's where private or places come in. There are several private models that work with employers to help rebuild skills of people who are may have been like doing caregiving, which people think of as soft skills, like empathy and communication. You actually can turn those into professional credentials. Those are really, those soft skills are things that help a business thrive. So those are just three models, but those are public and private partnerships. But really, we found that huge gap is around this whole empathy gap and understanding why caregivers are important, but also not putting up barriers for using the services that you're offering. Because then they go, oh, well, nobody used it, so we don't have any caregivers.
Definitely. Thank you so much, Donna. Really appreciate those thoughtful recommendations from both you and Duana. And it's also interesting to hear how a number of those recommendations from both of you, such as the partnerships or examining internal procedure or stigma, culture, aren't tied to just having the right funding. They're really opportunities centered around being intentional and strategic and purposeful. So thank you both for your initial insights there. And I will now pass it to Emma to see if we've received any questions from participants on the chat for you all.
We do have a few questions, and we invite others to share questions in the chat. I will note we have 5 minutes to the top of the hour, but we will be wrapping up with ways to get in touch with us and or our speakers, so the conversation doesn't have to end here today. Thank you again all for your attention and engaging with us. Before I turn it back to our esteemed subject matter experts with a few questions, I just want to acknowledge that as you all were speaking, we did get some comments in the chat too, where our participants were sharing ideas about things that can be done or perhaps they are doing to accelerate change in this area to support caregivers. So some examples, we're creating resources for caregivers who speak different languages, offering adult day services as respite for caregivers, and reducing administrative burden that takes time away from caregivers from managing work and finances. So again, thank you all for that. And with just a few minutes left, this question's for Duana. Can you share with the group briefly more about how you initially reached your business networks, and specifically any suggestions about formats to be used? Newsletters, emails, social media?
Great, good question. As indicated, we started with just small businesses that we had partnerships with. Started there and then ultimately recognized that we could do much more and faster if we were connected with the chamber. We've been connected with our local chamber here for a long time, but intentionally having conversations with them about not just us as a business, but who we are and what services and supports we provide, the value proposition to, economics, the value proposition to the community, and then ultimately the value proposition to their members. And then Emma, I can't remember the second part of that, but the second part was
About the
outreach.
specific formats. Yeah, if you use newsletters, social media
Yep.
to expand your reach.
Yep. So social media is probably our go-to. We have a huge following, and then not just, relying on the followers that we'd had in the past, but then again, leveraging the partnership with the chamber that would speak about us and encourage their members to follow the Area Agency on Aging on Facebook. And there we can put all kinds of information about the programs and services that we provide. And we consider the caregivers that we serve as a target audience in all of our social media and any of the outreach that we do.
Okay, you shared some helpful insight earlier about building relationships as part of building your networks as well. Anything to add to what Duana shared about how she's partnering with employers?
I would just add in terms of new partnerships is we found from all of our business things, they said, talk about return on investment. So one of the reasons that we started a podcast is that we're able to invite businesses to talk about who have these policies in place. What is their return on investment? And you have a different way besides something written that they may not see through social media. We have to have different ways of engaging the business environment. So you have to have these 5-minute talking points. You have to have the written ROI for their terms, and it has to be targeted for large and small businesses. So thank you.
Thank you so much. And I'm afraid that's all we have time for in terms of question and answer today. So I'll advance us to the next slide. But again, we really thank you all for joining us, and thank you to our speakers. Next slide, please. We hope you stay engaged with us. Please go to our website, check out our mailing list, and we'll provide all these links in the chat. We have a direct email address. So don't be a stranger. We want to hear from you. And we did receive a question we didn't have time to get to about identifying caregivers. Stay tuned on our listserv and on our website from forthcoming resources from the collaborative about identifying caregivers and raising awareness about services that are available to them. And before you leave today, or as you leave, you will get a pop-up seeking your feedback on today's presentation. We hope you'll take a few moments to respond to that and join us for our next webinar. We will soon be announcing a webinar for March. And again, just thank you to all, and we hope you learned something new today.